Feeling cold all the time is no fun. Certain conditions or behaviors can result in making you yearn for a sauna, but when addressed, can have you feeling like yourself again. Here's a look at what it could mean if you're cold all the time. It's a well-known fact that sleep is important. But did you know that one of its purposes is to regulate body temperature? As the National Sleep Foundation explained, not getting enough sleep can make you feel cold all over. The American Academy of Sleep Medicine, or AASM, recommends that adults get at least 7 hours of sleep every night. If you are getting less than that, try to improve your sleep habits. This means a consistent nightly bedtime. The AASM has provided a list of tips to help poor sleepers establish healthy sleep habits. It includes advice like turning off your phone, TV, or other electronics at least a half hour before going to bed, avoiding caffeine in the evening, reserving your bed for only sleep and sex, and avoiding eating a big meal before hitting the hay. If changes to your sleep habits don't help you get more rest and feel warmer, it's a good idea to talk to your doctor. According to a 2010 study published in Population Health Metrics, subjects who were slimmer were cold more often than those with higher body mass indexes, or BMIs. A lower BMI can also mean poor circulation, which affects body temperature. The study's conclusion states, "We found that thermal discomfort with cold extremities occurs at highest intensity in younger, slimmer women and lowest in elderly, stouter men." If you're underweight or not getting enough nutrition, your body can't generate enough heat to keep you warm, and you'll be hypersensitive to cold. People with eating disorders like anorexia may notice this. You might also want to lift weights because building muscle will help with body heat. As New Scientist reported, muscles play a role in keeping the body warm by contracting and triggering shivering. Muthu Periasamy of Ohio State University told the publication, "Our findings demonstrate for the first time that muscle, which accounts for 40% of body weight in humans, can generate heat independent of shivering." When the thyroid gland can't make enough thyroid hormone to keep the body running normally, this results in a condition called hypothyroidism, as defined by the American Thyroid Association, or ATA. The thyroid gland is normally located in the lower front of the neck. The hormones it secretes into the blood are carried to every tissue in the body. The ATA said, "Thyroid hormone helps the body use energy, stay warm, and keep the brain, heart, muscles, and other organs working as they should." There are a number of worrying symptoms that can occur as a person's biological processes begin to slow. They include feeling tired, feeling cold, dry skin, constipation, as well as forgetfulness and depression. But because these symptoms can vary from person to person, there's only one way to confirm a diagnosis of hypothyroidism: a blood test for thyroid-stimulating hormone, or TSH. The American Society of Hematology, ASH for short, asserts that anemia is the most common blood disorder affecting more than 3 million Americans. If you don't have enough red blood cells or your red blood cells aren't working properly, this means you're short on iron and your body lacks oxygen. This can result in cold hands or feet. Other symptoms include weakness, fast or irregular heartbeat, pale or yellow skin, and headache. ASH explained that many people are at risk for anemia because of poor diet, intestinal disorders, chronic diseases, infections, and other conditions. Women who are menstruating or pregnant and people with chronic medical conditions are most at risk for this disease. The risk of anemia increases as people grow older. According to ASH, anemia is diagnosed when the blood test shows a hemoglobin value of less than 13.5 grams per deciliter in a man or less than 12 grams per deciliter in a woman, with normal values for children varying with age. Feeling cold or having episodes of chills could be symptoms of kidney disease. Next Generation of Clinical Research, also known as NICR, had this to say: "Kidneys are responsible for producing a hormone called erythropoietin, which signals the body to bring in oxygen-carrying red blood cells. Low production of this hormone can result in anemia due to kidney disease. According to Johns Hopkins Medicine, 1 in 3 adults in the U.S. is at high risk for developing kidney disease." In describing the symptoms, the medical center revealed that the anemia from kidney disease can make the body, quote, "feel cold even when in a warm room." We should stress that feeling cold isn't the only symptom of kidney disease. Others include swelling, fatigue, skin rash, itching, metallic taste in the mouth, shortness of breath, nausea, changes in urination, dizziness, and trouble concentrating. The leading cause of kidney failure, the final stage of chronic kidney disease, is diabetes, with high blood pressure being the second leading cause, Johns Hopkins Medicine revealed. If you've noticed that your fingers and toes have a tendency to feel numb and cold, you could have Raynaud's disease. This condition causes some areas of your body to respond this way to cold temperatures or stress. The Mayo Clinic said, smaller arteries that supply blood to your skin become narrow, limiting blood flow to affected areas.
It might be more mild where your fingers just get cold. They can get really pale. Even over time, they can get that blue hue.
If you're a woman or live in a colder climate, you're more likely to have Raynaud's disease. During what's called an attack, affected areas of your skin may turn white before turning blue and feeling cold and numb. For most people, Raynaud's disease isn't disabling, according to the Mayo Clinic, but it can affect your quality of life.
It's really a matter of discomfort. They need to stay warm or their fingers will get cold and achy.
To prevent such attacks, you should take certain precautions before venturing out into the cold. The Mayo Clinic recommends things like warming up your car and bundling up in the winter months. You'll also want to take precautions against the cold inside your home, regardless of the season. This may mean putting on gloves before getting something out of the fridge or wearing socks and mittens to bed. Dehydration isn't just about not drinking enough. Sometimes it can be the result of diarrhea, vomiting, sweating, or urinating too much, or having a fever. A recognizable symptom is feeling thirsty, but if you let it go on too long, you can lose consciousness. Health has this to say about dehydration. If you lose just 1.5% of the water in your body, you've reached the tipping point of dehydration. Not having enough fluids can actually make you cold because your body starts to limit blood flow to the skin. As Luca Podesta, a sports medicine specialist, told Health, he further explained, in addition, water holds heat. So if you become dehydrated, it can be more difficult to regulate your body temperature, which can make you get chilly faster, even when you're not in a cold environment.
So you're being fooled by your own brain.
That's right, but for a reason. And then you start feeling shivers because shivering is a way to produce heat.
Although you may think of dehydration as something to watch out for in the summer, it's often easier on hot days to remember to drink more. This means dehydration can be even more of a threat in cold weather. And dehydration can happen quicker than you'd think, CNET reported. The best precaution is to be prepared. Wear the proper gear when you're outdoors and stay properly hydrated. Feeling cold could be a side effect of a medication you're taking. Beta blockers, which treat high blood pressure and other cardiovascular issues, are one example, according to Healthline. You may especially feel the cold in your fingers or toes. As the UK's National Health System explained, beta blockers may affect, quote, the blood supply to your hands and feet. Harvard Health pointed out that taking lower doses of beta blockers will then have a lower chance of causing side effects. That's why the tricky part of taking beta blockers is finding the right dosage to manage your health and avoid as many pesky side effects as possible. Harvard Health added, if a side effect appears, don't be too quick to switch. Adverse effects sometimes go away as the body gets used to the drug. If it persists, changing to a different beta blocker can often take care of the problem. Note that you need to be just as careful stopping a beta blocker as starting one. Always consult with your healthcare provider. When you get older, the heat-retaining layer of fat under your skin starts to get thinner, while your blood vessels' walls also lose their elasticity. All that adds up to your body conserving less heat and a drop in blood circulation, and feeling colder more often and more easily. Metabolic responses to the cold also slow down with age. A 2011 study published in the Journals of Gerontology found that average body temperature was found to be significantly lower in older age groups. Feeling cold may be frustrating enough, but it can also be dangerous. Because age makes older adults more susceptible to feeling cold, they're at risk for developing hypothermia, cautioned Berkeley Wellness. This doesn't mean that it has to be sub-zero outside. An indoor temperature of 60 to 65 degrees Fahrenheit can do it. Fortunately, the remedy here couldn't be simpler. Wear the right kinds of clothes to help you stay warm. For instance, when you wear a hat, make sure it's one that totally covers your head, and that includes your ears. Berkeley Wellness explained, you lose about 30% of your body heat through your head. Peripheral artery disease, or PAD, occurs when plaque builds up in the arteries that carry blood to the rest of the body, explained Medical News Today. This is also known as atherosclerosis. What this does is narrow the arteries, making it more difficult for blood to flow through. As a result, there's less blood flow to the extremities, creating a feeling of coldness, numbness, tingling, or pain in the hands, feet, or both. The American Heart Association warns that many people mistake the symptoms of PAD for other conditions. and it often goes undiagnosed by healthcare professionals. People with PAD are at higher risk for coronary artery disease, heart attack, or stroke. Factors that can increase your chances for PAD include age, high blood pressure or high cholesterol, smoking, and diabetes. But diagnosing PAD is easy and painless, according to the American Heart Association. In some cases, it can even be managed with lifestyle changes and medication. Women tend to feel colder than men. One study found that women's hands and feet are colder by some 2.8 degrees Fahrenheit, according to National Geographic. Women also have lower resting metabolic rates than men, as found in a study published in the Journal of Applied Physiology. In fact, men actually have a metabolic rate that's about 23% higher than women's. This means that a faster metabolism leads to more heating up of the body and explains why men are able to eat more without gaining weight. A third reason women may feel colder than men can be tied to hormonal birth control. Women already have higher core body temperatures than men, according to a study published in the Journal of the American Medical Association. Ironically, oral contraceptives, also known as birth control pills, can raise a woman's body temperature further, making her more sensitive to the cold. You know your body best, so if you feel like something is off, talk to a healthcare provider. As Dr. Natalie Azar, a rheumatologist at NYU Langone Health, told Woman's Day, if you've been cold your whole life and that's just you, that's great. But if feeling cold is a new sensation, you should have that checked out. If feeling cold is associated with shaking chills, fever, or if your body temperature is lower than normal, Azar advises seeking medical attention. In the meantime, there are some ways to get yourself warm. WebMD suggested heating up your clothes in the dryer, wearing layers, exercising, and using a space heater. The site also advised wearing socks to bed, or at least warming up your feet in slippers for an hour before calling it a night. Check out one of our newest videos right here. Plus, even more Health Digest videos about your favorite fitness facts. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.